I think about a month ago, NFL player, like he just fell down on the ground.
Yeah.
And they said, so what was that? Because I don't know do you know any details about it? What happened to him?
Well, I'll preface by saying I'm not a medical professional
Yeah.
in any way.
Yeah.
But I think that when this event happened,
Yeah.
it struck a lot of people that, oh my God, heart disease
Exactly.
is a thing. And I think it brought awareness to the fact that we need to learn how to do CPR. We need to learn how
Yes.
to use AEDs.
Mhm.
And I think that's really important because performing CPR and using AEDs can save someone's life. And we saw that, right?
Yeah.
So that is important. Yeah. So Dr. Sandra, hopefully she should be here any minute. So we will, if she's here, we will talk like how heart health or the hormonal replacement therapy and all these are very important for your heart health.
Yes.
So while you are doing the research, so tell us something about this hormonal replacement therapy.
So as women age, their levels of estrogen decrease,
Okay.
which leads to menopause.
Yeah.
And the average age of menopause in Canada is 51 years.
Okay.
Now, there are different things around menopause that can affect your heart health. For example, having early menopause is a risk factor for cardiovascular disease.
Okay.
So premature menopause is considered menopause prior to the age of 40 years.
Okay.
And that might be a risk factor for cardiovascular
How
disease.
does it affect that when you are saying that early menopause will, so what happens, why it is risky?
Yeah, so there's a lot of research being done in this field, and I'm not sure that we have an exact or clear answer on this, but one of the postulated mechanisms is that estrogen might be a hormone that helps your heart and is good for your heart. So with menopause, as your estrogen levels decrease, if that happens earlier before it's supposed to, it might actually be damaging to the heart.
So, in general, when we say about the woman's heart or the man's heart, so which one is weaker, or there is no such thing?
I wouldn't say weaker. So there are definitely certain differences between men's and women's heart.
Okay.
So for example, women's hearts are typically smaller in size, and the electricity in the women's heart is different compared to the electricity in a man's heart.
Okay.
So there are some definite physiological differences.
Okay, what is electricity? Do they have a current in there, like AC, DC current? What's electricity?
So your heart has an electrical rhythm, I
Right.
guess you could say.
Yeah.
And the way it conducts would likely be different.
Okay.
Okay, so that is how important estrogen hormone is for women's health. So when we talk about, supposing I ask you, what are the signs and symptoms of women getting a heart attack? Because being a medical person, I know, but of course we have to let people know, because sometimes they are not aware of it.
Absolutely.
And that, I'm having this symptom, maybe it's something like that. But there are some things that you don't even realize it, that these are the signs and symptoms.
Yeah.
So tell us a little bit about it.
So oftentimes we see, you think of the stereotypical chest pain, tightness in the chest. You might get some pain around your jaw, aching on your arm or shoulder blades. Other symptoms would be nausea or indigestion, fatigue that is not normal, excessive or abnormal sweating, shortness of breath. These are all symptoms of a heart attack.
In women especially.
And women. It can also happen in men, but men often present with the more stereotypical chest pain, sweating, whereas women may experience the nausea, indigestion, fatigue, like a tingling sensation in their chest.
Right.
And women are more likely to present with a constellation of symptoms. So they wouldn't just present, well, they can present with one or more symptoms, but they're more likely to present with multiple symptoms.
Yeah. So like especially in the South Asian families, or like in a woman, if they're working from home or they don't work outside, they're just staying at home or like doing their homework. But of course, they don't go to doctor regularly to kind of have it checked, because I know like in our house we don't go regularly, and even doctors say please come every 6 months, like depends on your age, and just have it checked. Just in a good way, just want to make sure you are healthy inside out. So, like those women, what do you want to say to our family members, the one I think you like listening and viewing right now? Like, don't become lazy and make sure you have it checked, because we have a facility, especially in North America.
Yeah, I wouldn't necessarily say that it's laziness. Oftentimes, women get busy with taking care of not only themselves but also their families. They have other commitments. Oftentimes they're doing our chores, they're taking care of the house, on top of having a job and all these other things. So I understand that it's not really laziness, but just not having the time for yourself. So I think it's really important to be mindful to make time for yourself, and getting these checkups are very preventative, right? Like getting your blood work done. These are all things that we can do. We can monitor your cholesterol levels, and we can change these little things if they're abnormal, which can help your heart health.
Because see, the problem with with especially women staying at home, especially with those that they're taking care of the house, they're taking care of children, they have to do this, they have to do that, and in that situation they forget about themselves, and that is the problem, that women are having more and more heart problems and heart attacks and all that, because they don't come to know by sar mein dard ho raha, and they don't know why my headache is it because I'm tired, I'm not feeling well. But headache could be because of the high blood pressure, and then that is affecting high blood pressure affects your heart.
Absolutely.
And then your heart doesn't work properly, and they don't realize these things, and when the time is and seriousness happens, then it's too late.
It's too late to go and get it.
This is very important for women, who are listening to us. We really urge them to, as Nabilah is saying, especially, the postmenopausal women whose estrogen level has gone really down. They are the ones who have to really get their checkups done, if not 6 months, but at least once a year.
Yeah. So need awareness about it.
Absolutely. Blood checkup is really important.
Very important.
It tells you about so many things.
Yeah.
And blood pressure and all these things have the bone density, and all these things are very important.
Yeah. So what about the family history? Let's say if my parents had like heart attack or heart problems, so does it kind of scroll down to the women, like individual?
I think that your genetics definitely matters, but I think there's a lot that we can do beyond genetics. So there are modifiable things that we can do in our life to decrease our cardiovascular risk. And 80% of cardiovascular disease is modifiable, which is a really large percent. And this would be by limiting alcohol intake, living free from commercial tobacco and vaping. Other things would include getting exercise, so 30 minutes a day for 5 times in a week is also very important. Limiting salt and sugar and processed foods is also important. Aiming to have 7 to 10 servings of fruits and vegetables daily is also very important.
Wow.
And taking your medications as prescribed is also very important.
Always.
And that people don't do that.
They forget.
Especially as you are aging. That is the time, but you should have your thing. Those pill boxes, I would urge everybody, you have a 7 days pill box, and you have all your medicine, and then you will see still the medicine is lying in that day. Monday wala to khaya nahi.
Abhi tak khaya
nahi, and the Tuesday has come. So those are the things, and these are very normal, regular things, but people don't take care of that. That, forgetting your medicine, or forgetting to take, and especially, fruits, I know a lot of people. They don't eat fruit
They
properly.
don't. No, that's
No,
right.
They don't, and they don't have enough vegetables and fruits in their diet. And that tells us. And we have a dietitian today in our studio who's going to join us and let us know about how important the diet is for the women's heart or anybody's heart. You know.
So you just mentioned the alcohol, vape, smoke. What are the serious of all these things? Especially women, or especially, of course, they're gonna if they're gonna kind of get pregnant or expecting in the future. So especially high school kids, and I know you are in high school. You've been in university now. What do you want to say about is it good, bad, or don't touch at all, or maybe sometimes? What do you say?
I don't know because I don't do any of it.
Yeah.
So I think just trying to be cognizant of the fact that it may be potentially harmful for your heart health. And, in moderation, a lot of times people, when they're celebrating, they like to have the occasional drink. So I think if you put too many limitations on yourself, it's kind of hard. If you're, for example, if you have been smoking for a very long time, it's really difficult to quit. So I think you need to have a support, find the support and find ways to quit. But it is probably very, very difficult. And along with alcohol, in moderation, not every day. But if you restrict yourself too much, you're not going to stick with it and follow through.
That's true.
I think in everything, if you have that urge to have smoking done or alcohol, so everything in moderation is good for your health. Rather than just depending. When you become a dependent person on something. It's always bad.
Always bad. And especially, of course, we live in North America. It's so easy to access all those things, especially pandemic. I think they were saying the alcohol consumption has been up in North America during the pandemic. I think this is a way to go, how to control it. And of course, it will affect either way. You are man and woman. If you're drinking so much or vaping so much, it will affect you in the future either way, right? Yeah.
So, any news of Dr. Sandra coming in? Did you get anything from her? Yeah. If not, then we can call the dietitian meanwhile. We think we should just text her.
Okay, so why don't we just take a commercial break?
Yeah.
And then we'll be right back. And of course, the one who are watching on Facebook, you can still keep on watching. So we'll take a break and we'll be right back with Nabilah and with Dr. Sandra and Brinda Rao. So she's a dietitian. So we'll be right back, guys. You are listening to Salaam, Namaste, Calgary on Punjabi National Radio, 94.7 FM.